Good morning, good evening. Today we're going to cover tracheostomy cleaning at long-term facilities or special step-down units like 5 North at St. Joe's, respiratory therapy, or even in the ICU. We're responsible for cleaning the trach, and this has helped reduce infection. Usually when the tracheotomy is performed within the first 24 hours, you'll do minimal suctioning, and most of the time you won't really change the gauze, and that's to allow time for the stoma site to clot off and stop bleeding. Sometimes though this will happen anyways. It depends on what's happening with the patient's condition post-surgery. Alright, so this is the kit that is usually used to clean the trachs at Joe's Main up on 5 North. You just have to collect the supplies individually. The policy at Joe's Main is that they use sterile water. They do not use hydrogen peroxide. At other hospitals, they still use a 50-50 mix of hydrogen peroxide. So let me open the kit. And you'll have the green sterile gloves. You'll have a little napkin. I highly suggest you put the napkin on the shiny side on the chest of the patient to keep the sputum that they'll cough up off of the patient. You'll have 2 Q-tips. You'll have a wire brush. You'll have a suction catheter inside this kit. Now we don't use this anymore, but it'll have a tie. We used to tie the trach on the flange, and the tie would go through these 2 slots of the trach. And then you'll have a full gauze, and then the gauze with the upside down cross. I use a new one when I do it because they're more the gauze is more flat and it's easier to slide up under than this one. So you would take your water and pour your water in, okay? And then the first thing you would do is pull the gauze out. Make note of the consistency of the sputum, the color, and how much, the quantity, because this is what you have to chart in Cerner for Baycare. And then what you do is take your disposable and throw it away and put a new one in. But let's say this is the locking type. You put it in your water and let it soak, or if you're at another hospital, 50-50 hydrogen peroxide. As that soaks, you would take your gauze with some sterile water and clean around the stoma and on the part of the trach that's behind the flange, right here. Okay, there'll be blood, sputum. A lot of times when they've had the trach for a while, it'll be crusty. Okay, you want all those little tan, crusty, or dried up blood. Okay, if it's a new one, 24 to 48 hours later, you want to get the blood off of there. A lot of time on the outside of the flange, around here, and sometimes just inside here. You don't want to get anything down in the inner lumen of the trach. So you want to make sure you wring out your gauze real good. Okay, and then you change the strap. We use a Velcro strap. I don't have one available to show you. And the first thing I do is whenever I'm cleaning the trach, I hold it